Director of Behavioral Health Services and Mental Health SF here at the San Francisco Department of Public Health. We're holding this press conference this month on the heels of the most recent preliminary data released today from the Office of the Chief Medical Examiner. Fentanyl-driven overdose deaths remain at crisis levels at a national, state, and local level. Last month, according to the preliminary data from the Office of the Chief Medical Examiner, 64 people lost their lives due to accidental overdose in San Francisco. This is an increase from last year, this month, when 52 people died of overdose. As has been the trend for several years, most of these deaths involved fentanyl. And we are holding this press conference today because DPH takes these deaths very seriously. Each life lost reaffirms our mission to reduce overdose death and reduce the racial disparities in overdose deaths among people losing their lives. DPH is responding by focusing on high-impact interventions that save lives. What this means is to work aggressively to make treatment for addiction more easily available and accessible, to support people in recovery, to lead healthy and integrated into the community lives. We are focusing resources on communities and individuals experiencing high rates of overdose, including people who have had a prior overdose, people experiencing homelessness or with unstable housing, people who are Black or African American, and we are including both treatment and targeted overdose prevention outreach and engagement, aiming to reach more people at risk in order to save lives. One of the most effective interventions are medications that treat opioid use disorder or opioid addiction. These medications, specifically buprenorphine and methadone, each reduce a person's risk of dying by approximately 50%. I really cannot understate the effectiveness of these medications. They save lives and they are within every person's reach. Right now, buprenorphine is available across the San Francisco Health Network, including in primary care and hospital-based settings. Methadone is only available at licensed opioid treatment programs, but DPH is working at every level of government to support regulation changes underway at the federal level and at the state level in order to reduce the barriers that can inhibit somebody from entering and staying in treatment. Another important treatment intervention we are investing in is contingency management. Contingency management is a behavioral therapy that can help people stop using stimulants such as methamphetamine and cocaine and get in and stay in treatment. We want everyone to know, even though addiction is a chronic illness, recovery is possible. There is a way out of addiction and into a healthier life. I'd like to now welcome to the podium Dr. Christy Soran, who will share more information about our contingency management expansion to help people with stimulant use disorder who may also have opioid addictions. Dr. Soran.
Thank you, Dr. Kunins. Hello, I'm Dr. Christy Soran. You spell that S-O-R-A-N. I'm the Deputy Medical Director of Substance Use Services for the Department of Public Health for San Francisco. Contingency management is an evidence-based treatment for people with stimulant use disorder due to cocaine and methamphetamine. Contingency management uses reinforcement or rewards for evidence of positive behavior change, such as stopping stimulant use or engaging in treatment. While there are effective medications for alcohol use disorder and opioid use disorder, there is no equivalent medication to help people recover from stimulant use disorder. Contingency management is the most effective intervention there is for stimulant use, and there's more than 50 years of science to back this up. Contingency management is based on the principle that reinforced behaviors are more likely to occur. Consistently reinforcing a positive health behavior trains the brain to associate that behavior with positive rewards and sustain it over time. Recovering from stimulants improves an individual's health and reduces their overall risk of overdose. The U.S. Department of Veterans Affairs has been using contingency management to treat veterans for stimulant use disorder for decades. Only recently has it become more widely available in a public setting. Currently, San Francisco County is one of 24 counties participating in a contingency management under Medi-Cal through the state of California. Contingency management is available through the Department of Public Health at Zuckerberg San Francisco General Hospital, including the opioid treatment outpatient program and Bridge Clinic, the office-based buprenorphine induction clinic at 1380 Howard Street, citywide clinic, and through the San Francisco AIDS Foundation and Health Rate 360. DPH also recently launched a contingency management program at the Maria X. Martinez Health Resource Center, our urgent care and transitional primary care clinic for people that primarily serves those experiencing homelessness. During the first cohort of the Maria X. Martinez Contingency Management Program, none of the participants had an overdose during the 12-week program. Participants were also grateful for the support group and community building component of the program. This year, DPH will be growing contingency management programs citywide. By investing in well-studied interventions backed by science, San Francisco can save lives from the overdose crisis affecting so many people nationwide and our fellow San Franciscans. Thank you.
We do have time for questions. Anyone has any?
Contingency as a treatment form. To clarify, I'm familiar with it in terms of the use, as you mentioned, with drugs like cocaine, etc., stimulant. Is the suggestion here that it's being now applied to opioid addiction? And the second part of that, what data is available to show how effective it is?
Excellent question. The programs that I mentioned are focused on stimulant use. However, there are also programs that can use it for other substances, specifically remaining on medication treatment for opioid use disorder or remaining engaged in treatment. But the programs I mentioned are focused on people who use stimulants and helping them recover from stimulant use disorder. Contingency management has been shown to help people engage in treatment longer, reduce and stop stimulant use, and has solid evidence to support that. We really have no other intervention for stimulant use besides contingency management.
Anyone else?
I'm just gonna add one more bit of follow-up, which is that the majority of overdose deaths in San Francisco, while driven by fentanyl, also involve other substances, particularly stimulants. So by reaching people who use stimulants and helping them to stabilize their lives, we expect that we will see some positive health outcomes for all of their substance use.